I have 3 children. 2 of them have real jobs. My last daughter graduated from college. Because of the economic times, she's one of those late bloomers. She's on my insurance now until she reaches a certain age, and she has no insurance. I want her to be covered. I think there needs to be some kind of policy that will cover people who are working. She's working every day now at a minimum wage job with no benefits.
Right.
No benefits.
Right.
And I tell her, I say, you need to get a real job with benefits. The benefits mean more than the salaries. Teachers will tell you this. A lot of teachers are hanging on just for the benefits. Just for the benefits. So that's, we are paying for a lot of these people who go to the emergency rooms because they can't go to a regular doctor. They wait until they're really, really sick, and then they end up at the emergency rooms. That puts up the cost for all of us. All of us. I don't know if there's a question there, but those are my comments.
I'm a state employee, and I'm in the same position that teacher is. We haven't had a raise in 5 years, but our insurance premiums are going up. The state of West Virginia is a self-insured employer. No matter what happens with this health care, self-insured employers will be exempt from it. I want to be able to go in and be able to make a choice of the health care plan that may have better benefits than what I have under PEIA, and have a choice whether or not I have a public option I can select from. Go maybe with Blue Cross Blue Shield, I mean whatever may be out there, but I want the same options that my Congress people have in their insurance. I get up to that.
I mean, I don't talk about, let's not compare the burger flippers in Toronto to the burger flippers in Detroit who don't have anything, don't have a thing. I mean, those poor, underpaid, McDonald's is doing fine in Canada. Ford is doing okay. I don't know about General Motors, but you know, capitalism is working great with covering everybody, because in that country, and every citizen of that country, and I mean everyone, has a fundamental dignity that allows them to go to the doctor and be treated. It's just unbelievable that forces in this country don't want to have been resisting that. And it's shameful. And it's shameful that our politics are turning on that too. This should be a Republican-Democrat issue. I guarantee you the rightest-wing conservatives in Canada are in favor of their health care insurance. American businesses just got to get with the picture, and this has become something that we all are to take proud of. Now, having said that, I'm deeply troubled to hear Perry Bryant tell me that 94% of the people under some bill are going to be covered. What about those other 6%? Those people are entitled to dignity. They may be goofy teenagers who think they're invincible and don't want to buy insurance, but when they get that dignity and start flipping those burgers with insurance, they'll feel good about it. How can we hope to move this system to truly cover everybody, and who are those 6% or 7%? Can you answer that for me, somebody?
About a third of them are illegal immigrants. The remainder are people who will fall through the cracks. There are a number of exemptions in any of the individual mandates, for example, for religious purposes or for financial hardship. But there'll be others who would prefer to pay the penalty rather than be uninsured, particularly young, invincible people. But that's basically what it is: young people and illegal immigrants.
Yes, sir.
My question is, with the cost tag that's associated with all this, I don't think I've heard anybody discuss how we think we're going to pay for that. There's been some discussion about savings from different programs, so on and so forth, but I'd like to get a feeling from each panelist as that price tag, which is it $900 billion?
Yeah.
Where that funding is going to come from. How much of it's going to be from proposed savings that we can achieve through better programs that we've all talked about tonight, versus how much of it's going to be through new taxes that our future generations are going to have to bear. I'm concerned about the future generations, not only their access to the care, but how much they're going to have to pay for it. Because right now, if you look at the government models, we're unable to pay for those things. That cost is then being transferred to all of us that are paying for private insurance. So I'd like for each panelist to give me an idea as how they feel that $900 billion will be paid for, please.
Sure, I think that's a good question. And looking at some of the statistics, the House bill is estimated to cost about $1.2 trillion. The Senate Health bill, $645 billion, and the Senate Finance bill, $829 billion. Those are the estimated costs according to the Washington Post. Over 10 years, that's correct. So why don't we start here to the left, Larry? You want to address a little bit of that?
I would certainly make an attempt, but I have to remind myself occasionally that during one of the most deficit-building decades in my life, we didn't hesitate to spend more money on a war in Iraq. I know that if we have the political will to do it, we can fund this without adding to the deficit. It'll be a myriad of adjustments, and it'll be a myriad of shift in cost. It could be that we will see a mandate for employers to pay a percentage of payroll. It could be that we'll see those folks who make $300,000 annually or more pay more taxes. It could be that we'll see cost reductions due to waste and efficiencies in the Medicare system. It could be cost savings as a result of Medicare Advantage. It could be a lot of things, but I am convinced that we can have affordable health care for every American without raising taxes on middle-class Americans.
There's a joke.
Currently, we have national debt in the range of $100,000 per every living American. We can, many of the things that we have talked about, we can deliver. We simply have to be willing to pay for them. In Germany, German workers pay 14.9% of their gross pay for their health insurance program. Much of what we envision and wish for and talk about tonight will be similar to what the German program offers. The cost in Germany is 14.9% of gross pay for every worker, and the program currently is running at such a deficit that it's going to have an additional government bailout. So I think we are making a mistake and doing ourselves a disservice to say that we can do all of this without additional cost. Insurers are going to pay, the insured are going to pay, and clearly businesses are going to pay.
Reverend Patterson?
I would agree with, I believe that Larry laid out basically the proposals that are on the table in terms of where the additional revenue will come from. But I would also agree with Steve that this is going to require some sacrifice on all of our parts. I don't know whether to get down to what's called the middle class Americans or not, but I believe in the end it's going to cost all of us something. And if we're touting this and saying it's the right thing to do, it's the moral thing to do, then we have to be willing to pay for it.